morning, friends. Welcome to Dr. PM Times. This is Dr. Murugesan. Friends, in this episode, I am going to concentrate how a person evolves from pre-diabetes stage to an established diabetes. Otherwise, the stages of diabetes. Diabetes is not sudden in occurrence, as I have already told you. It has got a slow progression. The problem starts with either an impaired insulin secretion by the beta cells or decreased action of insulin in the target organs, a receptor defect, say in the muscle, the liver, the adipose tissue, which are the target organs where the insulin receptors are predominantly situated. Excess fatty acid in these receptors, accumulation in these target organs can cause an insulin resistance, which is common in obesity. Also, it could be due to an increased glucose release from the liver, which is called glycogenolysis, breaking down of glycogen into glucose, which is mainly due to the hormone glucagon. I have already told in the definition itself, diabetes is not alone due to defective insulin secretion. It is also due to a moderate increase in glucagon. This glucagon causes increased release of glucose from the liver by glycogenolysis, which is the cause for mainly the fasting hyperglycemia. That is where the effectiveness of the drug metformin comes into play. Metformin suppresses this hepatic release of glucose and thus controls fasting blood sugar level mainly. So the stages, it starts with stage 1 where the insulin secretion may be normal. The blood glucose level also will be normal. The person is absolutely euglycemic, that is having a normal glucose level, but the insulin level may be increased due to the insulin resistance, which is called hyperinsulinemia, which is the first stage of diabetes. Then in the second stage, again, the insulin secretion may even be increased to compensate for the increased insulin resistance. Insulin resistance augments, there is more insulin resistance. And the first thing to be affected in insulin secretion is the first phase of insulin release is affected. Insulin, to remember, the release occurs in two phases. The first phase, which occurs within few seconds and lasts for 2 to 3 minutes, it is the release of already secreted and stored insulin as granules in the ribosomes of beta cells of islets of Langerhans. The second phase, which occurs after a stimulus of oral glucose load with the help of incretins, occurs in stages from pre-proinsulin to proinsulin to mature insulin. So it takes a few minutes for onset and lasts for few hours even. Initially, in type 2 diabetes, it is the first phase insulin release in response to food intake is affected, which will lead to an elevated postprandial blood sugar level, or it causes postprandial hyperglycemia because of the loss of first phase insulin release. Later on, when the person becomes an established diabetic, the second phase insulin release also is affected. So they have an increased fasting blood glucose level also. So the point I would like to stress is for a diabetic, a new diabetic, it is the elevated postprandial blood sugar level is earlier indicator. So you advise a person to take postprandial blood sugar level. Then fasting blood sugar level also increases if he becomes, once he becomes an established diabetic, where both phases, first phase and second phase also is gone, and then there is also an increased release of glucose from the liver by glycogenolysis due to a moderate increase in glucagon. So this is how a diabetic patient evolves from pre-diabetes to diabetes. That is, first there is a normal glucose level with hyperinsulinemia. Then he develops an increased postprandial blood glucose level due to lack of first phase of insulin secretion. And then once he becomes an established diabetic, there is both first and second phase impaired insulin secretion. Added on to that, there is also a hepatic release of glucose. So fasting blood glucose level also increases. If you have the knowledge of this development of diabetes, then we will know what investigation to order at what point of time. Thank you.